Hi guys, this is Dr. Tyler Pelfrey. I'm a small animal emergency veterinarian here in Central Florida, and it's 6:30. We're going to work.
Oh man, this is already a horrible day in the life. I forgot to mention our wake up. Woke up at 4:45, went on a 2-mile run, then got ready. It's not uncommon to do a short yoga, but you take what you can get here.
We're here at work, 6:45 a.m. I'm gonna go in and get rounds on the hospitalized patients and contact the owners, get our plans for the day, and wait and see what comes in today. Let you know a little bit more about what I do later. Yeah, this is weird, but we'll do it. I'll let you guys see what's going on. All right, so we have 2 inpatients right now. Post-op forelimb amputation and a hypoadrenal corticism Addisonian crisis that I took in yesterday. Both of them look great. We're gonna get some discharges ready for them and get them out of here before noon today, hopefully. Yeah, and now we play the waiting game, see what comes in today. It's really hit or miss with emergency. Sometimes it's all vomiting, diarrhea. Sometimes you get to do cool things. Chest tubes, laceration repairs, things like the Addisonian crisis that are near death and you fix them, but we'll see. I'll check back in later. So this is our Addison's disease patient, getting discharges ready. I like to use veterinary partner for client education. Just really good, concise things, and you can see that recently revised. But this is his blood work yesterday morning. So you can see his potassium is very high, as well as his creatinine, so he is azotemic. So with these cases, you have to be careful. Sometimes they can imitate imitate acute kidney disease. So we always like to run blood work on these guys, serial blood work while they're in hospital, just to monitor that. But I don't have the paper. It is in the computer, but this azotemia had resolved to normal, so creatinine was 1.0 yesterday before I left. And this is our electrolytes this morning, potassium 4.2. So things are stabilizing. Started this guy on presentation. We gave him a whole bunch of IV fluids, 0.9% saline, as well as a dexamethasone SP injection. Then performed an ACTH stimulation. He did not stim. His resting cortisol was 0.2, below 0.2 yesterday. And after the stim, he was at 0.2. So that confirmed Addison's to us. And with the resolution of the azotemia, I said, hey, let's go ahead and start Procortin. So we got a mg per pound of Procortin yesterday. Gets that every 25 days. He's also going home on some prednisone. We're going to taper that down, to a maintenance dose that he's going to get lifelong. Yeah, these cases are really cool, really satisfying. The owners are very grateful. Yesterday they thought they were going to lose their dog, and then you come at them with this and a dog that looks completely normal. So it's pretty satisfying. All right, so all my patients' treatment sheets are done. Owners have been called, notes have been done, discharge is done. So just waiting on incomings. Sit here, drink my coffee. I usually read whatever journals I have. Today we're reading Di Bartola, just because physiology stuff, science, smartness. I was told by a criticalist I worked with, the physiology, any case is manageable. So that's what we're doing, just reinforcing everything, though. Spent 4 years in vet school learning it all. Things fade away. So it's been 5 years since graduation, so almost 9 years since first started learning all this stuff. So it's always good to refresh on the simple things. Now we wait. All right. It's the next day, Sunday. Yesterday escalated pretty quickly. Didn't have time to do anything. Went from talking of the Addison's case to getting slammed
So we'll get around to discussing things a little bit more today, hopefully, or we'll go through once I get to work and kind of see what all I saw yesterday. Yeah, it's a crazy day, but we'll get back to you. All right, so we are on our way to work. Just stopped and got donuts for the crew, nurses. I had a rough day yesterday. I was a little bit crabby, so try to keep everyone happy, even though it should probably just not be a dick sometimes, but whatever. So yesterday, like I said, we started out pretty slow. I was able to take care of my inpatients, and then at about 10 o'clock it just hit the fan, one after another coming in. Nothing critical, a couple things, but it's mainly just high volume. Had a dog that the owners noted wasn't acting right for a day or so, very lethargic, and its abdomen was very, very distended very quickly. Dog had a history of a heart murmur. It wasn't really on any medications. So the owners thought that the lethargy and its trouble breathing were related to that, though that needed to be treated as well. But it came in, and with any, do your exam, your baseline, see that the dog does have an increased respiratory rate, gums are muddy, and the belly is very distended. When I palpated the belly, it was very, very hard, and the dog was kind of guarding it. So that leads me to pull out the ultrasound. I do a quick scan, or a fast scan of the abdomen. The spleen looks just like one big mass. It was mainly just like a mixed heterogeneity, and then a cavitary lesion in the center. Scant peritoneal effusion. So I talked to these owners. It was a 14-year-old dog. The respiratory could be caused from blood loss or just an imitator from the increased volume in the abdomen. But the owners didn't want to do surgery. They also did not want my recommendations for supportive care in hospital to try to stabilize while they discussed surgery. They were also not on board with euthanasia, which is, in a lot of cases, a humane treatment. Their goal is to prevent suffering, but they declined all that. They elected to take the patient home. So, what we did, I gave Unibial and a shot of dexamethasone SP 0.1 mg per kg, and told them I really don't think their dog's going to make it. They signed an against medical advice form. An hour later, the dog came back DOA, dead on arrival. So those are always tough cases, especially when, even though you are offering to euthanize their animal out of humanity and make sure the animal isn't suffering, they still don't go with you. So those are tough. A cat that had a cut on its upper and lower eyelids last week. At that time, the owners noted that the cat also had some clouding of the cornea. Over the last week, it seems to have gotten worse. And yesterday they brought it into me because the discharge in the eye, it had developed a very nasty discharge and was holding the eye closed. On exam, the globe was, on retropulsion, it was kind of flabby. A lot of mucopurulent discharge. Animal was very painful. You could see that there was trauma to the globe and the palpebra. So there's very high suspicion of a globe rupture, which in that case, being that old, requires enucleation. The owners didn't seem too concerned. It's just an eye. It's just an eye. Eyes are painful. They get infected, cause discomfort. So recommend enucleation. Due to finances, they declined my offer. I wanted to take the cat home with topical medications. I did not agree to that. So they called another veterinarian who could do it for cheaper than my hospital. Took the cat there. So hopefully the cat got the care it needed, and cats can live with one eye. But living with a bad eye is torture, in my opinion. So hopefully the cat got that enucleated. Another cat with a corneal ulcer. A lot of vomiting, diarrhea, because people give table food. Had a atopic dermatitis. Animal was 9 out of 10 pruritic on exam. So though it is just skin, it's not life-threatening. Patient comfort. So we did see that on emergency, just to make the patient comfortable. XSP injection, cefpodoxime for secondary pyoderma, cytopoint injection, sent home with a chlorhexidine shampoo. I think that was that. And what else? Marijuana toxicity. So the dog was perfectly fine yesterday morning, lying around, acting like itself. After one of the owners left the house and came back, the dog was didn't want to move. When it tried to stand, its legs fell out from under it. It's urinating on itself. So they brought it in thinking the animal was dying, which collapsed. It's a legitimate concern. On exam, the dog was mydriatic, OU, so dilated pupils. Had a hyper-responsive menace, so put the menace test, take your hand towards the eye. You're looking for a blink, a menace. In this case, the dog was flinching with that. It was photobic, so I shine my pin light in the eye, and the dog seems like it's bothering it. What else was it? Hyper-responsive to sound, relative bradycardia, so the heart rate was low. In a stressful situation in an emergency clinic with people you don't know, heart rate was around 70 in a small dog, so that's a concern. And just the overall mentation of the dog seemed inappropriate. Discussing things with the owner. So marijuana toxicity is usually a diagnosis on exam, which was my primary suspicion. Talked to the owner. Another owner in the house has a medical marijuana card, was putting THC concentrate on roast beef and eating it, and possibly gave some to the dog. So diagnosis, marijuana toxicity. Recommend hospitalization for these guys just to monitor. They're not mentally appropriate. If they vomit, they can lead to aspiration. They can become hypothermic, and there's fall risk at home, falling downstairs, falling on furniture. Hospitalization declined. They took the dog home. Sure it will be just fine. Yeah, a lot of other things we'll get into later. A lot of it is, unfortunately, it is financial. We can't do the appropriate treatment because of financial constraints, but medical care is medical care, unfortunately. So buy pet insurance, $50 a month, and get whatever care you need. It's great, so you don't have to worry about it. So it's definitely worth it. But I'm going to go into work, deliver the donuts, and hopefully have a good day. All right, no impatience today. Not yet, anyway. So sit here, do a little bit of reading, wait on the incomings. Trying to figure out what I'm going to talk to you guys about. And enjoy my coffee. All right, so we've had our first case of the day. Insect hypersensitivity. Dog ate, or got stung by a couple bees. It looks like the dog ate him. Muzzle edema,
Dog's BAR otherwise, no respiratory distress. So concerns with that, swelling enough that obstructs the airways. Gave a dose of 0.2 mg per kg of dexamethasone SP IV, 2.2 mg per kg of diphenhydramine or Benadryl IM, and I gave some meropitant as well. The dog seems a little nauseated. I'm gonna give it 15 or 20 minutes to make sure our swelling goes down. Gonna send it home on a short taper of prednisone just because it was so severe. Benadryl at home, and I'm gonna send it home on some omeprazole as well, just because we can't see with the histamine release we can possibly see some GI distress or ulcer formation. So just gonna cover all our bases.
Oh, whoa. 12 hours later, and I'm able to check in again. It's Sunday, so another fairly busy day. There's another ER doctor on today, so it lightened the load a little bit. Yeah, I had pretty good range of cases. Vomiting and diarrhea, so like non-specific gastroenteritis, pancreatitis. Had a few lacerations, some lameness. Dang, what else did I have? I don't even remember. Oh, we had a basset hound that had a mechanical ileus, so a foreign body obstruction in the intestines. So I took that guy to surgery, single enterotomy, some venous congestion, no RNAs or anything needed. And he was pretty young, so while he was under, he was a cryptorchid, so he had a retained testicle in his inguinal area. So I went ahead and neutered him while he was under just to save him another anesthetic procedure. So yeah, it's a good day. Surgery went well. Left that guy on fluid therapy with lidocaine CRI, buprenex, analgesia, pantoprazole, all that stuff. So he should be just fine. But yeah, it was a pretty good day otherwise. I don't think I saw anything else crazy. Yeah, whatever. But yeah, good day. I'm gonna go get a sugar-free Slurpee and call it a night. Alright, I'm pulling into the house here. I didn't get my sugar-free Slurpee. I got some mango sorbet though. So, I mean, it's covering 2 days, but that's pretty much, pretty much an ER doctor. You try to do something, but you get so busy that you don't. You get to see a good range of cases. I mean, whatever you're willing to do, you essentially get to do it. Myself, I prefer the more critical, sick things. But you take what you get, and you hope to make the animals a little bit better, and make sure that the family is happy and they get their family member back home, which is a big thing. And a lot of these emergencies, you're able to make a difference pretty quick and make everyone happy. So yeah, I would recommend it. Long days, but most ER jobs give you a good amount of time off as well, pay as well, just because you are seeing more cases, you're seeing the sicker cases. Yeah, it's great. So hopefully this doesn't discourage you, and it's not, there wasn't any video inside the hospital, I think, unless it was pointing at my face or some paperwork. But I don't want to give out, even though there are no HIPAA laws, I don't want to give out patient information and make clients mad, because it is their property, essentially the animals. So I'll leave you with some pictures of the surgery today. Cute basset hound guy. The pictures are post-op, a couple hours after he recovered from anesthesia. But I may make this a thing. I don't know. I like teaching, so maybe we'll make some teaching videos. Hopefully you guys like it. Thanks.